Welcome everyone to the conversation tonight around our BIPOC community conversations regarding the vaccine progress put on by the Vermont Health Equity Initiative. Tonight we'll be talking with Dr. Benjamin Lee. Thank you, Dr. Lee. Dr. Lee is with the UVM Children's Hospital. He's a pediatric infectious disease physician. And today we also have our good friend at UVM-MC, Karen Bastine, as well. I am Luis Calderon. I am on the board of directors for the Vermont Professionals of Color Network. And I am joined by my colleague, Blaine Intense, who is also part of the network. Blaine, myself, and our third partner, Wei Wei Wong, have led the charge for the last 16 weeks on behalf of the network and in partnership with other BIPOC-focused community organizations. We've been leading the work around the Health Equity Initiative and have stood up, and operated, and vaccinated over 3,500 folks down at the vaccine clinic here in Burlington, the BIPOC vaccine clinic. And we just wrapped up our 16-week, and it was an amazing experience. And we'll get into all of that later on in this conversation. But the focus of this talk here tonight is to see where we are at with the vaccine progress. We've hit certain benchmarks in the state and in the country, and we've asked Dr. Lee to come give us an update on where things stand and where we might expect things to turn at the end of the summer and into the fall. So with that, please help me welcome Dr. Benjamin Lee. Thank you very much, Dr. Lee, for joining us tonight, and I'll let Karen take over from here.
All right. Well, thank you so much for that welcome. It's always an honor to be a part of these conversations, and a huge thank you to the Vermont Health Equity Initiative for all the incredible work that you all have done over the last number of weeks. I think that you all provide such great resources to the community. And in my role, I just wanted to share that I work in the Office of Government and Community Relations, and that I am happy to be a conduit for any community conversations or questions if people watching this recording would like to follow up on either questions with some of our content experts like Dr. Lee or other things. So I'm actually mostly just going to be the person who runs the PowerPoint. Dr. Lee is the person who has the expertise and can answer a lot of the questions. And so Dr. Lee, I think I'll get started if you're good with that. Okay.
That sounds good. All right. Well, thanks everyone. It's also an honor for me to be here and to have this opportunity to be speaking with you all about our vaccine progress here in the state of Vermont. So, the summer is upon us, and there's a lot to be optimistic about and be proud of in terms of our accomplishments here in Vermont. But also there is still some work to be done and some open questions that still we need to get through. So thank you for the nice introduction. As mentioned, I am a pediatric infectious diseases physician with the University of Vermont Children's Hospital. And here are the topics that we would like to discuss tonight. What is the status of the current vaccination campaign in Vermont? And I'd like to discuss some information in a little bit more detail on COVID-19 vaccines for children and adolescents, and start tackling some of the trickier questions about what we can expect for our children over the next few months, given that children less than 12 is still a large group that is not yet eligible for vaccine. And going hand in hand with that point, I hope that we'll be able to sort of answer some of the questions for why it's still important that we continue our efforts at vaccinating as many people as we can. And hopefully, if there's time, I'd be happy to take questions from anybody. All right. So where are we in terms of vaccine progress in Vermont? So here, Vermont, there's no way to put it other than to say that acknowledge that Vermont is, as a whole, doing pretty well. Infection rates are low, and as I'm sure most everybody has heard by now, Vermont did hit that benchmark of 80% of all eligible Vermonters having received at least one dose of the vaccine. And accordingly, a lot of the regulations, restrictions, et cetera, that were first enacted by the state have since been lifted. And it's only fair to say that right now the risk in Vermont is probably as low as it has been ever since the pandemic started. And I'll have a figure that will sort of demonstrate that on the next slide. And so one of the messages that I think is really important for us to sort of get out there is that, now, right now the sun is shining. Let's take advantage of the beautiful Vermont summer and the opportunities that we have with rates being as low as they are, and with the current vaccination rates being as strong as they are. But we always have to still remain a little bit cautious, because as we've seen new variants emerge right now, the variant that's been causing a lot of concern in many locations is the so-called Delta variant. What we've seen is that this virus can develop new variants that may be more infectious, and as long as there are more infectious variants circulating and populations of unvaccinated people, COVID is still going to remain with us. So we still have to at least remain on our toes, because the situation can change quickly. The rest of the world, unfortunately, isn't doing quite as well as Vermont. As I just mentioned, the reality is that this virus probably is not going to go away. This is a virus that's going to be with us for a long time. In many regions of the world, countries are experiencing third and even fourth surges of COVID-19. And there are many countries in the world in which the vaccination rate is in the single digits, if anybody has been able to get vaccinated. So there's still a lot of progress that we need to make from a global perspective in terms of bringing this pandemic under full control. And there are a lot of unanswered questions still that we're trying to figure out in terms of how we continue to live with COVID-19 going forward into the future. And there's a lot yet that we still have to learn. So this was the figure that I had mentioned. This is a chart from the health department website that just shows the total number of cases over time since the pandemic began back in March of 2020, which seems like 1.5 million years ago to me, when we saw that first surge of COVID when it first entered the state. But by and large, over the summer, with a couple of exceptions, so that first big spike in May, that was the first outbreak that we had in the Winooski neighborhood. But with a couple of blips here and there, during the summer months, we generally saw very low rates of COVID-19 all throughout the summer of 2020. When we went into the winter, that became a different story as people spent more time indoors, as a lot of fatigue started to set in, and before people had before the majority of the population had access to vaccines, we can see that all throughout the winter, there were lots and lots of cases. But right towards the end, as we get into May and June, what we see is a dramatic drop off in cases. And that's a combination primarily of the successful vaccination effort, but then also return of warmer weather. So those two going hand in hand, we can see that the total number of cases we're seeing on a daily basis are similar to what we were seeing back last summer, in the difference now being that many people have the added protection of vaccination. And so when we look at, break it down by age, race, and ethnicity, we can see the sort of the demographic breakdown of who has been getting vaccinated. So not surprisingly, sort of hand in hand or consistent with the way the vaccines were rolled out among the different age groups, we see the highest vaccination rates in older Vermonters. They've had the longest and greatest access to vaccine. And it begins to dip lower and lower as we get towards the younger age groups. And so I would argue that we need to do a better job getting more of these young people vaccinated. because while it's 80% for the state overall, you can see that for younger people, it's still well below that. In case you're wondering why these numbers don't quite add up to 80, the 80% figure, those are based on CDC data, which actually has a little bit more in it than what the state counts on their dashboard. So just in case you're wondering, these are current data, and for the state as a whole, we are over 80%, although not every single vaccination is captured on the state dashboard. When we look by race, we definitely see a different pattern. So white Vermonters, without question, have the highest rates of vaccination. And we definitely see some areas of concern, particularly within our indigenous populations and Pacific Islander populations. We see quite low rates of vaccination within those groups. So there's still a pretty broad range in terms of vaccine coverage. And so despite the fact that I mentioned we've been doing well across the state as a whole, it's really clear that we still have populations in which we need to be doing a better job at getting vaccines to these populations and communities. Okay. So just as a brief overview of the vaccines that we're talking about, currently in the US, we still are at 3 different vaccines that are eligible for use under an emergency use authorization by the Food and Drug Administration. The first and earliest was Pfizer. This is a 2-dose series given 3 weeks apart. And so far, Pfizer is the only one that's approved in teenagers. Teens 12 and above are eligible for Pfizer vaccine. Moderna is very similar to the Pfizer vaccine. It's 2 doses given 4 weeks apart. Currently, it's authorized for individuals 18 and older, although they have submitted for an emergency use authorization for teenagers 12 to 17 as well. So hopefully Moderna will become available for our teens in the near future. And Johnson & Johnson is the third. It has the advantage of being a single shot, but again, is only available for those 18 and older. There are a number of other companies that have ongoing trials or have potential vaccines coming online. So one that received a lot of press recently is Novavax. They've recently published or reported some very, very strong results for their vaccine in adults. So it looks like we'll probably have a 4th vaccine joining the party soon. AstraZeneca is still the #1 vaccine used across the world, but it's not approved or authorized in the US. And there is a question at this point, given how strong the other vaccines, how strong of a presence those other vaccines have had already in the US, whether or not AstraZeneca will ultimately become approved in the US or not. We have lots of different options now. Okay, so how does this relate to teens and children? So it's important to recognize that the risks to children from COVID-19 have really been pretty much the same throughout the pandemic in terms of how they potentially could get it. At the end of the day, the biggest risk to a child is an adult in their household. And it's usually adults who pass this virus on to kids, not the other way around. And similarly, it does appear that younger children also do not seem to pose a large risk to one another. That doesn't mean that they can't pass it amongst themselves, but they just don't do that nearly as efficiently as adults can pass it amongst themselves. And it is very true that children who do get infected with this virus typically don't develop severe illness, but there are always exceptions. There are some rare complications that seem to affect children, such as MIS-C, known as multisystem inflammatory syndrome in children. And while it's not quite as common, children are also able to get what's known as the long COVID syndrome, where they may have long-term ongoing side effects after the acute infection. So in general, the risks are lower to children, but they're not zero, and they're always, as long as the virus is circulating, that is always something to be cognizant of or to be aware of. Okay. This is a graph that shows cases among school-age children. These are just children who were attending school this past year. If you remember the earlier figure that showed the large spike in cases over the winter time, this sort of almost perfectly matches that. And what it demonstrates is, whatever happens in kids, basically kids reflect what's happening in adults in the community. And so what we saw was that at each age range, for elementary school kids in blue, middle school kids in purple, and high school kids in green, those rates sort of tracked along with the rates that we saw in adults over the winter. And fortunately, once we hit May, again, with the success of the vaccination campaign, we really saw those rates plummet. So vaccinating adults helped protect kids. And by the end of the school year, we saw very, very little COVID-19 among kids. And fortunately now they're on summer break, or some maybe in summer school, and we expect that trend will continue. Okay, so when we talk about the vaccine specifically in young people, as we mentioned before, the Pfizer vaccine was the first vaccine that was authorized. It initially was authorized for people 16 and older back in December, and the emergency use authorization was extended to include teenagers down to the age of 12 in May. And so for all the middle schoolers and high schoolers who have been getting vaccine so far, it's all been the Pfizer vaccine. As I mentioned earlier, Moderna now has completed their trial for their vaccine in children 12 to 17, and they had very, very strong results. So similar to the Pfizer vaccine, if you look at, in the study, teenagers who got both doses of the vaccine, no cases of COVID-19 was seen in those kids. So extremely, extremely effective in kids 12 to 17, just like the Pfizer vaccine. And both the BIPOC and the ELL clinics currently are using Pfizer vaccine. So that's what would be administered there. Okay. And so the work continues for those who are under the age of 12. So there are active clinical studies that are being conducted right now in the US for children between the ages of 6 months and 12 years of age. The Pfizer clinical trial has them broken down into different age strata. So 5 to 11-year-olds, 2 to 4-year-olds, and 6-month-olds to 23 months of age. And in each age group, clearly, a 6-month-old is a completely different size than a 15-year-old. So one of the questions is, do we need to look at potentially altering the doses that are given? And so for each of these different age ranges, they're testing both low, medium, and high doses of the vaccine to see which one seems to give the best immune response while limiting the rate of side effects. And Moderna has a similar trial. Their trial sounds almost identical in terms of design. So again, they're looking at kids from 6 months up to 12 years of age, and they're testing also 3 different doses to make sure that they're going to be able to find the correct dose for the different age groups. Both of those companies report that they think that they'll be able to complete, or at least have a preliminary data for those trials by the end of the summer or early fall. And so if that's the case, there is a possibility that younger children, elementary school age kids and kids in daycare, for example, may be able to start getting vaccine later this fall or winter. But that really remains to be seen. It just depends on how well the clinical trials go to show that the vaccines are safe and that we have the right doses dialed in. But it would be terrific if we could, if during this upcoming school year, we can start getting the younger kids vaccinated as well. Okay. When we look at the breakdown of people who are represented in these studies, so just if we look at race and ethnicity in the 12 to 15-year-olds who participated in Pfizer's, we see about 15% were people of color, about 12% Latinx or Hispanic. The Moderna trials, I don't have the numbers here listed, but the Moderna trials were a little bit better than that. It was about 30% people of color. And my understanding from talking with some of the investigators and experts who are more heavily involved in those trials is that the expectation is there will be a similar representation in terms of the percentages of people of color in the trials for the younger age groups as well. Okay. And of course, the big question for all parents is, are these vaccines going to be safe and effective for young people? We already have some pretty compelling data on teenagers and adolescents. They were tested on thousands of young people, and in the clinical trials, thousands of young people and tens of thousands of people of all ages. What's really sort of most remarkable, though, is since the emergency use authorizations, these vaccines have literally been used in hundreds of millions of people at this time point. And there have been lots and lots of different groups who have been looking very closely at both not just the clinical studies, but also the real world use of these vaccines to make sure that these vaccines continue to demonstrate safety. And it's very likely, as the CDC has said, these vaccines will probably have the most intensive safety monitoring in US history. In other words, these are going to be the most heavily watched and scrutinized vaccines ever in terms of safety. When it comes to children or adolescents, 12 to 15 at this point, as mentioned, the vaccine was very effective at preventing COVID-19. And thus far, it looks like in terms of safety, the rates of side effects that they saw has been similar to what they would have expected for adults as well. There's a little bit more on that I'll touch on in just a second. We know that so far, based on the studies that have been done, people who first got vaccinated all the way back late last year, it looks like they're still very well protected. So the slide says that we know that the vaccine protects for at least 6 months, but at this point, it probably is going to prove to be much, much longer than that. But whether or not we'll need booster shots either this year or next year, that's still an open question. But so far, we couldn't have asked for sort of a better vaccine. Early in the pandemic, I don't think any of us in the medical or scientific community dared to dream that the vaccines would actually be as good and as safe as they proved to be. Okay, so let's talk a little bit more about side effects. Most people, or some people, don't have any side effects at all. It's not uncommon, however, for people who do get these vaccines to have some fever, some chills, headache, fatigue, nausea, or muscle aches. These are usually fairly mild, and you go away after a day or two. In my opinion, it's a very, very small price to pay in terms of having a day or two where you don't necessarily feel all that well, if you know that that's going to protect you from getting severely ill from COVID-19. More recently, and this is something that has received a lot of attention in the news, there's been some concern that rates of myocarditis, now that is an inflammation of the heart. This condition may be increased in young males, meaning in the adolescent age range through young adulthood, following receipt of mRNA vaccines. This is still being investigated, but appears very rare. But just this afternoon, some more news came out on this front. The ACIP, the Advisory Committee for Immunization Practice, it's a branch that basically provides expert guidance to the CDC about vaccines. They met this afternoon to review all of the data that they had about myocarditis following mRNA vaccines. And what they found was that, number one, it was extraordinarily rare. It does appear that in very rare circumstances, there does appear to be an association between this occurring shortly following receipt of vaccines, but that even when it does happen, it's very mild. and most people recover completely within just a matter of days. Um, and what it's pretty extraordinary was that after the meeting, a joint statement was published. Um, it included the heads of the I believe HHS, the CDC, pretty much every major public health or medical society in the United States all came out with this extraordinary joint statement that says there might be an association here. However, it is so clear that the benefits of the vaccine so far outweigh this tiny risk that all of the health authorities in the country unanimously are saying absolutely these vaccines need to be given and should be given to everybody who's not yet vaccinated. So for more personally, if your child does get vaccinated and has side effects, usually all that's needed is just a little bit of rest, a little bit of fluids. If they do have fever, some Tylenol or ibuprofen should be fine. But of course, anytime you have concerns about your child, then calling your doctor or primary care pediatrician would always be a reasonable step to take. Allergies was a frequent question, particularly earlier on when these vaccines were still getting rolled out. But it's important to recognize that having allergies does not disqualify your child from getting the vaccine. The only type of allergy that would disqualify your child is if they had a known allergy to the vaccine itself or a component in that vaccine, and those are extraordinarily rare. But people with food allergies or allergies to other medicines, they would need to let the folks giving the vaccines know that. But that is not a reason that would disqualify your child from getting the vaccine. For me personally, this affected me personally because I have a severe allergy to wasps, so I have to carry an EpiPen in case I get stung by a wasp. But I had no concern at all about getting my COVID-19 vaccine because I knew that that type of allergy is not going to pose a risk. So all that is important to remember is if your child has had any type of allergic reaction to anything in the past, that's something that would just need to be discussed with the folks providing the vaccine. Usually it would just mean they might want to watch your child for a little bit longer afterwards for 30 minutes rather than the standard 15 minutes. But that should be really it other than extremely rare circumstances. Okay, and so earlier I was talking about how great Vermont has been doing as a whole. So why this ongoing discussion for why we need more vaccine? Because a lot of time I think it's a very natural response to look around and say, well, everybody's told us that we now have more than 80% of eligible people vaccinated, so we don't need any more of those earlier restrictions or mandates. So why do we need more people to get vaccinated at this point? So I would argue that there are a number of very important reasons that we still need to remember how important it is to get every single person who wants a vaccine and is able to get one to get that shot into their arm. So the first, and this is a pretty common topic of discussion, is this concept of herd immunity. So basically what this means is if we get enough people vaccinated, the ability for the virus to spread within a community becomes much, much lower. So that's number one. The more people we get vaccinated, it still becomes that much harder for the virus to spread. Now, there are still unvaccinated people out there, including, as mentioned before, all of our children 12 and under. There are adults who yet remain unvaccinated. And there are also adults, there are some groups who, even if they got the vaccine, may not have had as good of a response to the vaccine as other people. And so this could be people who have some type of immunocompromising condition, people who are taking medications to suppress the immune system, for example. So there are still people out there who are still going to be at higher risk for getting severe illness if they catch it, and by vaccinating those around them, that can reduce the chance for any of them to become infected. We talked a little bit earlier about potential side effects of the vaccine. And as I mentioned, in my mind, the risk of some mild side effects is when you compare that to the risk of actually getting COVID-19 and all the potential complications, for me, it becomes a pretty easy, the math becomes pretty easy. Give me the vaccine rather than the complications of catching COVID-19. Going along with increased rates of infection. So if you have areas where there's not good vaccination and higher rates of infection, whenever we see that, that's always going to contain the risk of new variants developing. So I would argue that, even for places where vaccination rates are very high, as long as there's virus circulating somewhere in the world, there's always going to be a risk for new variants to come in. And it's still no guarantee that a new variant couldn't slip in and maybe cause more infections. It could be more transmissible amongst those who are unvaccinated, or even for those who are vaccinated. I think the biggest fear that we all have is that could a variant arise that basically the vaccines no longer protect against. I highly doubt that would happen based on how strong the immune responses to these vaccines have been. But that always will be a lingering question. So the more people we can vaccinate, the less likelihood that we can let a new variant slip in and gain a foothold in our community. And so the final two bullet points are sort of similar to what I had said earlier. In particular, the mRNA vaccines, like the Pfizer and Moderna vaccines, so far they've been able to handle any variant thrown at them, and there have been a lot of studies that have shown that. So the best way to protect all of us is for everybody to get vaccinated, and that will let us continue the success that we so far have enjoyed.
So with all of these reasons to get vaccinated in mind, the Vermont Health Equity Initiative is partnering with the Association of Africans Living in Vermont to continue to do BIPOC clinics in the Burlington-Winooski area. These vaccines are 100% free and they don't require any amount of health insurance or proof of identification. These clinics are going to be registration or walk-in. So anytime that you're available during these clinics, please do come in. They are on Thursdays and Saturdays, Thursdays at the Old North End Community Center and Saturdays at the Winooski School District. You can visit the vermonthealthequity.org to register and confirm clinic times and location. And we have plenty of multilingual resources. Our website has full translations on it, as well as the vermontforall.com website. It has a variety of other multilingual resources on the vaccine, on COVID, on testing, and other resources that there are. We also have translation and interpretation services at our clinics every time.
So at the end of the day, here's the good news summary. June 14th was the day that we hit that 80% threshold of eligible Vermonters having received their first dose of vaccine, which has allowed the governor to lift many of the COVID-19 restrictions. So just to reiterate, right now, the risk in Vermont is as low as it ever has been since the pandemic started. Non-Hispanic whites have higher vaccination rates than BIPOC Vermonters, but encouragingly, this gap really has steadily decreased recently. So the difference now is 5% based on the latest Department of Health data. And more immediately for our teenagers, those who are fully vaccinated no longer have to quarantine if they're exposed. This opens them up to being able to travel, to spend time outdoors without masks, and indoors now for that matter if they're fully vaccinated. And so it's just, just a feeling of liberation, I think, for folks who, once they get fully vaccinated, in terms of being able to return to the life that they remembered enjoying before the pandemic hit. Is a really, really strong incentive for getting everybody vaccinated. The hope is that younger school-age children may be able to start getting vaccinated this fall or winter, although that's still to be determined. And at the end of the day, getting the vaccine is not only the best way to protect yourself, but also to protect those who either can't get the vaccine or who are at high risk from COVID-19. So thank you for your time and attention, and this opportunity to share some of share our progress and sort of give an update on the current landscape. I'd be happy to take any questions if there are any.
Thank you, Dr. Lee. I do have a few questions for you. I'm going to read them off. Because I do think since the last time we spoke, and this is, as is the nature with this experience, it continues to evolve. New things come up all the time, and so it's in regards to the Delta variant in Vermont. What are we seeing with the Delta variant in Vermont, and what do we know about how the vaccination, how effective? So there's two questions. Like, what are we seeing with the Delta variant in Vermont, and then also just in general, like, I know that all of the vaccines are obviously effective, but can you give us a little bit more about, like, what is behind that exactly? And there's as you said earlier in the presentation, there's always this fear and concern that there could be a stronger variant that comes along the way, and we might have to do this all over again. But where are we at right now with that? I have heard and read that, let's say with the vaccine, with a Pfizer vaccine, and for some reason you have had COVID, that is going to make you at this point the most immune to everything. Can you expand on that a little bit? That's a two-part question.
Yeah, no, I'd be happy to. So the Delta variant has been detected in Vermont, so it is here. The total number of detections has not been that high, but that's also in the context of there being very low case numbers, period, across the board, going back the last couple of weeks. So it's safe to say that the Delta variant is here. If we look a little bit more broadly, just sort of in the Northeast region, the most recent data that I'm aware of from the CDC suggests that amongst all cases, it's maybe in the neighborhood of about 10% of all cases. And that's an increase from just 1% about a month ago. So it definitely is spreading. So far, the Delta variant is the variant that's believed to be the most infectious of all the variants we've seen so far. So that is a concern, and so I think that the fact that the Delta variant is here does make me a little bit more concerned for unvaccinated populations, that it might be easier for them to potentially catch it compared to, say, last summer when the strains that were going around were not nearly as infectious as the Delta variant. So it definitely is here. The good news is that the studies that have been done that show both how well the antibodies work after getting vaccinated, and from studies from other countries where they've had already more experience with the Delta variant, shows that definitely the mRNA vaccines, like the Pfizer vaccine, is still able to protect against it. So another strong rationale for if there are folks who still are eligible but still have been holding off on getting it, now's the time to get it, because the Delta variant is here. In regard to the other question, one of the common questions that we get is, I've already had COVID, so why should I get the shot? And it turns out that this is one of the situations where, in fact, the shot probably does a better job that natural infection at protecting you in the future if you were to come across the virus again. And there have been studies that have demonstrated that, particularly for people who had COVID once and then get vaccinated, their immunity, the levels of antibodies they make and the strength of the antibodies they make is just on a whole other scale. So for those people who have had it and then get vaccinated, they really reach sort of, they reach a level of immunity that is sort of head and shoulders above what most of us can get. And with 2 doses of vaccine, that's still really good. But for the people who have gotten COVID and then get vaccinated, they're sort of the immunologically elite. They're the ones who make it to the NFL, if we're going to use a sports analogy in terms of how good their immunity is. So I actually would like to tell folks, if there are folks who say, well, I've already had it, so I don't need to get vaccinated again, or I don't need to get vaccinated. In fact, you're in a very, very unique position to have potentially the best immunity going forward. And so I actually use that as I think, if anything, that's even more reason to get vaccinated, even if you've had it once before.
Sort of like super immunity.
Yeah.
One other question about the Delta variant. So it is, it's, as you said, it's a lot more contagious.
Mm-hmm.
But is it more deadly? I mean, are we seeing that internationally? Like, is it?
Yeah, I think there is some concern that it could also be more severe as well.
Okay.
Part of the reason is that the viruses that look like, each time we get a more contagious variant, usually what goes along with that is it's able to just reproduce a lot more, make a lot more virus. And so there is some thought that the total amount of virus that ends up reproducing in your body can sort of might predict how severe of an illness you might get from it. So with each variant that becomes better at reproducing and replicating, there is a concern that may go hand in hand with more severe illness as well.
Got it. Another question. As the rest of the states open up and adults are no longer wearing masks or taking as many precautions anymore, I imagine that would increase the risk to kids that aren't vaccinated, including 6 months to 11, the 6 month to 11-year-old age group. And currently, schools aren't requiring kids to wear masks. What is your advice, Dr. Lee, specifically for parents with young children and those sending their kids back to school in the fall?
Yeah, I think this is probably going to be one of the most challenging sort of questions facing families with young children going over the summer, and certainly as the new school year begins. So it certainly is true that that the greatest risk to kids, as I mentioned earlier in my talk, is the adults around them. So there is some rationale that if enough of the adults are vaccinated, that will reduce the likelihood that the vaccine can then spread to a child. When I mentioned earlier, one of the things I mentioned earlier is that when we looked at the rates of infections in school-age children, that really plummeted over May and over the course of May and June. Part of that was the teenagers themselves getting vaccinated, but a lot of that was also the adults in their lives also getting vaccinated and reaching higher and higher levels of protection. That having been said, this school year, all kids were wearing masks indoors, right? So it's sort of, so vaccinating all the adults protected kids when the kids were wearing masks indoors. And so I think that anytime I think the risk is going to be lower to children in general this summer and fall, just because there's so few adults who are now around them who are now infected. but anytime you have a large group of people gathered together indoors who are unvaccinated, there's always going to be the risk of an outbreak, because all it takes is just one infected person, at the right time, that could maybe, infect other people and cause an outbreak. So me personally, I do think that the risk is much lower now than earlier, certainly earlier in the winter, and maybe even compared to last summer, because we have this added benefit of the vaccine coverage. But I don't think it would at all be unreasonable for unvaccinated people to continue to wear masks when they're indoors. And so even if it may not end up being, it may not end up being a requirement that unvaccinated kids mask when they're in school, like we had this last school year. I don't think it would be unreasonable for parents to say, I want my child to continue to wear a mask while they're in school indoors with other children. Just purely from a personal standpoint, that's probably what I'll do with my kids. I have an 8-year-old and a 6-year-old who both attend public elementary school, and until the younger children can also get vaccinated, uh, I I think it doesn't hurt to have as many people indoors masked as possible. Um, so um, um, so yeah, and it's going to be interesting to see how this continues to develop over the summer and fall. If the rates of the virus go away completely, like if we do such a good job that we see 0 cases, then that might be a scenario where we say, wow, the risk is so low now that we probably can get rid of masks altogether. But I don't think it's ever wrong for somebody who has an unvaccinated loved one, for them to continue to wear masks when indoors.
Well, that's a really great point. I think that's really helpful for a parent who again, like so much information. So this is changing day by day, hour to hour, and at a certain point, it becomes, it's hard to keep up on all of the developments. So I think it's really helpful for any parent who might say to themselves, what am I, when I turn my kid over to school, what
Mhm.
can I, as a parent, advocate for, ask for personally, what makes me comfortable, me and my family comfortable as it relates to my kids and wearing masks indoors. So that's a really great point. Thank you for sharing that with us. And now that we've reached this 80% mark for eligible Vermonters, what happens next for the remaining 20% and the ability to reach larger herd immunity? Like, can you get into that a little bit more? I know you spoke on it earlier.
Yeah, well, I think the biggest change now is, and this is something that we're seeing not just in Vermont, but sort of all across the country, is, the time and the time of these mass vaccination campaigns is sort of coming to an end.
Mhm.
So I think getting those remaining unvaccinated individuals vaccinated, it is, the work is, if anything, going to become a little bit harder. It's going to require more intensive outreach. I think part of this might involve, or be aided by having vaccines be available in not only lots of different public venues, but potentially now also in primary care offices and medical homes. I think will probably be an important part of it as well. Because I think the important thing to for everybody to keep in mind is, just because we've hit 80%, it does not mean the work can stop. We need to get as many people vaccinated and protected as we can. Just the approach to that, the strategy, the game plan is going to have to shift a little bit, because the people who are easy to reach, or or who are most eager to get the vaccine at this point, they've already been taken care of. So it is going to involve more outreach, making vaccine available um, in multiple locations, including ones that may be more familiar and comfortable to folks, such as in medical homes. I think will be important developments as we continue forward over the course of the year.
And as an infectious disease doctor at the Children's Hospital, are you personally hearing questions from patients or their parents that you think are important to clarify in general?
Well, I think we probably touched on most of the important points already in the course of the talk. I think, you know, at the end of the day, what I just want parents to know is that is that um, you know, the vaccines are safe and effective. I mentioned earlier, you know, I didn't dare to dream, you know, last year, um, before we knew what the outcomes were going to be. I didn't dare to dream that we would have vaccines as safe and effective as the ones we now have. And that's really the take home point, is that the vaccines are safe and effective. They're absolutely terrific at protecting people against COVID-19. And I have no hesitation at all in recommending these vaccines. I think that the COVID-19 as a disease, I have so much respect for what this disease can do. And and again, for kids, the argument always has been they don't seem to get severe COVID. So that's true most of the time. But boy, I would really hate to be, um, you know, for that one exception to be my loved one, or my child. And so absolutely, as soon as my kids are eligible for the vaccine, I'm going to be first in line. No question about it.
Yeah, as a parent, also, like I mean, I was so stressed on it on both sides. You know, I'm a young, healthy person, but you know, I did not want to be wrong. You know, my goal is to be able to be a parent as long as I possibly can be, to become a grandparent, a great grandparent. You know, and so I was not comfortable running that risk at all. And then as a parent, worrying about my children, you know, they're young and healthy, but they have their issues also. And I was so grateful that that we were able to get our vaccines, and you know, that they're okay. And I am grateful to science. I'm grateful to the incredible effort and the science that has just moved the mountains and really, you know, brought these miracles to us. You know, it's remarkable. Well, Dr. Lee, thank you so much for your time tonight and for sharing these updates with us. And we look forward to chatting with you again. Again, Dr. Lee is the Pediatric Infectious Disease Physician up at UVM Children's Hospital. Karen, thank you so much. Karen Bastine is the Senior Community Relations Officer at UVM Health. Karen, we are so grateful to your support and your friendship and all the help you've led and given to our organization, the Vermont Health Equity Initiative. Thank you to my colleague Blaine for being awesome as always. And if anyone out there has additional questions, comments, concerns, please feel free to reach out to us through our social media channels, on Instagram. All of that stuff is linked somewhere here on this website or on this platform. This is the Vermont Health Equity Initiative, and we are continuing to keep this information up and going as the storyline continues to evolve. So on behalf of the Vermont Professionals of Color Network and VHEI, thank you all for tuning in this evening. Have a great summer.
Thank you.